So now we have Dr. Veerle van Geenhoven, who is affiliated as a senior veterinarian at the Centre for Clinical Veterinary Medicine that is part of the veterinary department at the Ludwig Maximilian University in Munich. She is currently leading the small animals department. So Veerle is going to speak to us just now on the veterinary triad in balint work about professional relationships to pets and their owners. And if I can now hand over to you, Veerle, please. Thank you.
Well, thank you very much for this introduction and also for having me here, that I have an opportunity to speak about what became, well, something that I've been working on for 2 years now. It is sort of a private initiative that I took, and because at some point I learned about balint work, and then I realized that this could be something for veterinarians to help them thinking about their professional relationships, especially about the emotional part of it. So I just have to, it's a little bit slow, I see. Okay, so what is this talk about? Well, this talk is about professional relationships in veterinary medicine and also about the burden they place on vets. And it is about how balint work, I will explain what balint work is about in a minute, might help interpret and disentangle the complexity of these relationships. Why this topic is important, I think we, especially those who are here today in this symposium, know that this topic is important, the topic about professional relationships, because dealing with clients, animal patients, and everything that goes together with it is more than just mastering veterinary communication skills. I mean, it requires really cross-species psychosocial competence, in addition to what we know as veterinarians, in addition to what we know about clinical competence. And when you ask the question, what do vets learn about psychosocial competence? I mean, for instance, in vet school, then I'd say, well, it's a good question with a very unsatisfactory answer, at least for the schools I know in Belgium, where I studied myself, and also in Germany, where I'm living right now. I would call this the academic gap. I mean, because this psychosocial competence is not really part of our education as a vet. And in this presentation, I'm trying to give a contribution to fill this gap by interpreting veterinary professional relationships by means of balint work. And the balint method is something what is, at least in Germany, it is something very alive in human medicine, where you get together with a group of peers to interpret and disentangle doctor-patient relationships from, I mean, the emotional part of it. And this method aims at a patient-oriented medicine versus a disease-oriented medicine. And it is also using insights and tools from intersubject psychoanalytical approaches. It is always keeping the psycho-hygiene, I mean, the mental health of the participating therapists in mind, and it is case-based and peer-supporting. What you need to do to get your balint work done is a balint group leader. These people are accredited by the International Balint Foundation, so many countries, also the UK, have balint societies. They educate balint group leaders because these people are sort of a shelter for the group, especially for the referent who is presenting a case, for instance. And without a group leader, you cannot fulfill the work. It's important to know that balint work is not a therapy, but it may have therapeutic effects. So the starting point that I'm taking here is I'm sort of jumping a little bit ahead because I'm already thinking about balint work from a veterinarian perspective, because of course, if you look at human medicine, there you have this patient-doctor relationship, which is like a diet, but we are dealing with it, at least with 3 people. We are dealing with the vet, we are dealing with the pet, or 3 individuals, the vet, the pet, and also the pet owner, at least. And very often there is more involved than that. So this veterinary triad, let me just give the picture that I have of this triad. So there's 3 people involved, and there is this close bond between the pet owner and the pet. And then as a vet, the first interaction you have is actually with this pair of individuals. And I call this the primary triad. And this primary triad has a dynamic potential in that from each, like from this relationship with the bond, there is a relationship growing with the pet owner on the one hand, and on the one side, and with the pet on the other side. There's like 2 individual relationships. So that is sort of what I call the secondary triad that grows out of this primary triad. And this picture is adapted from a paper that I recently wrote, and that will appear now in December in the Balint journal. And the reason that I wrote it is that if you want to like adapt balint work for veterinarians, you also have to sort of talk to balint group leaders, whether they are willing to work with veterinarians, because at least in Germany, veterinarians are not really, they don't know balint work yet, and also balint group leaders have not worked a lot with veterinarians so far. So you have to communicate with that group too, and that's why I wrote this paper on the veterinary triad, because it is so different from human medicine, or at least there are different points. It's not completely different, but there are these differences. Okay, so now I sort of don't. I can continue. So if you look at multiple professional relationships, as you can see it in this veterinary triad, they require multiple veterinary roles. And so if you look at the secondary triad, I filled in also the roles that the doctor has. The veterinarian has a doctor role for his patient. He has an advisor role for his client. He has also he also needs some expertise in the human-animal bond issues, and also many other things involved. So there is at least these 3 roles for the vet. And actually, if you start to visualize this relational and functional complexity, then the burden that professional relationships have on veterinarians sort of becomes, it gets a face, receives a face. So if we now go back to the balint method, there, the major part of the work that is done there is to interpret the emotional aspects that come with veterinary professional relationships. And so if you get back to this triad, there is the relationship between the vet and the bond. So the bond, which is the human-animal bond between the pet and the pet owner and the pet. And then you develop professional relationships also between the vet and the patient, and the doctor-patient interaction, actually. And then there is also the interaction with the pet owner, where you sort of expect some adherence from the client. So there is this complexity that then enters, there is emotional aspects in all these interactions. And that is actually what then enters balint work. And what I've done now is I made a little sort of, well, how you call it? Well, you see, to sort of show the course of a working session in a balint group. So there is like these veterinarians that gather, and together with human doctors and a balint group leader, they sort of build the group. And everybody's like first introducing himself, one another. And what is important about balint work, about this group, is that when you gather, when you meet, you're meeting as medical professionals and not as private persons. And I think that is something really, really important, that there is the professional part standing at first and not the private part. Because what I often see in all the measures taken to sort of do something about our mental health often end up being private initiatives. And I think it is important that we are also setting up professional initiatives, so as non-private persons. And what is nice about multi-professional medical groups, as the one that I designed here, is that you get like a variety of perspectives and also a variety of emotions on cases that are presented in these groups. So how do these things then continue? So then the balint leader asks, well, who brought a case? And then people are saying, like participants are saying, okay, I brought a case, and there's now in this case 2 people who would like to present the case that they brought. And what is important about this is that sort of the group decides on which case is then being presented. And also the balint group leader decides whether this is really a balint group case. Why is this important? Well, it should be a case on professional relationships and not on some private relationships. And this is something that then the balint group leader decides upon, because it's not, the idea is not that this is a therapy group or anything about your own private problems. Of course, they're often disentangled with, or like there's this entanglement with your professional work, but yeah, it should be really a professional issue. So that's what the leader then decides upon.
That's 3 minutes to go, please.
Yeah, I started a little late, so okay. So then veterinarian B presents his case or her case with the vet. With pet and the pet owner and the relationships that are involved, and then he starts telling about this like a story about an owner and a rabbit and some former treatment. And why I'm putting in these emoticons is like just to really point out that this is about the emotional aspect and not so much about the medical aspect that comes in the case. So then the case is given to the group, and you can then some more additional questions can be asked to the referent, which are then quickly answered. And then when those questions are being dealt with, the balint group leader will ask, okay, the referent now is taking a spectator's position, and the group starts working on this case. It brings in perspectives on the case, connotations, emotions, thoughts, and images. And then the referent is sort of there sitting first with his own perspective. And then while the group is working on this, the perspective of the referent is sort of growing. And while it is growing, I'm just like going a little bit quickly through this because I want to be within my time slot. Then the balint work ends, and then the veterinarian returns to the group. The referent returns to the group with this new bunch of perspectives. And what this will then give, or at least that's one of the goals, is that the perspective of this veterinarian is sort of broadened. Okay, that is in my next slide. So the output of the balint work will be what I just mentioned, the broadening of the perspective through the group's contribution. But also you learn more about empathy because you sort of start to realize what others think about the case, and that other people may have other priorities, other desires, other opinions. And it really gives you a tool to learn empathy towards others. It is also a tool that gives you professional self-awareness because you sort of start to recognize your own role, your veterinary role in the case, and also you start to differentiate between the veterinary and the non-veterinary part that you contributed to the case. It is also a way to start to learn to demand adherence from the pet owner once you sort of have this professional self-awareness growing. And it is also a way in which you can sort of enrich your psychosocial competence because you learn through this balint group leader, who is like a certified person and also someone who knows about psychoanalysis. You learn about intersubjective processes of transference, countertransference that are part of the interactions with the owner and also with the pet. And you also learn about self-protection, and you also learn that you learn to experience protection from the group and also from the balint group leader. So all together, these are really very positive effects. There is also one additional effect that the balint group work will give you is what I call, or what is called the mirror effect, is that the balint group sort of very often it happens that the balint group makes the referent experience the case new, including the emotions. And that can be very, like a confrontation with the group. And that is also why you need this professional balint group leader. So my last slide now is, well, okay, if we, so the idea with the balint group work is that you start to reflect on professional relationships, especially the emotional part of it. And it also says something, I think, about the status of veterinarians, especially if you have these multi-professional groups. So what I mean is, on the one hand, balint work is on interactions and relationships between individuals, the vet, the pet, and the pet owner. But it is also, so that is the case that was introduced before, but it is also society comes in, because this multi-professional balint group is also sort of a micro society. And you sort of, when you are the referent and you present the case as a veterinarian, you start to realize that what is the value of animals in our society, and also that is often, I think, linked with the value of veterinary profession in society. So that I think that the view on animals, or the low view that is often on animals from society, is also sort of has an effect on how our profession is being looked at from society. And so just to close up, professional self-awareness is about recognizing the status of vets resulting from individual interactions with pets and their owners, but also the low status, I think the low status in very many cases, the status of veterinarians in today's society is also, I think, due to the low status of animals. And that is sort of a thing that I experienced through the balint work that I went through, that when you hear from the group opinions that are so different from the ones that you have, it makes you realize like what status animals have, and also what status veterinarians have related to that. So, well, I have listed here some literature, which is only just like a short version. And if you want to know more about this topic, I'll be happy to receive email from you, or just to answer them later in the question and answer period.
Fabulous. Thank you very much. That was a really insightful, fascinating presentation. And it has stimulated some questions, so we'll come back to those. I don't know if you can see the chat. You can maybe have a look if you want to do a bit of thought about response to those. But thank you very much for your time. And I do appreciate it. 15 minutes is really not very long to get across such a lot of information for all the speakers this afternoon.